She was having one bowel movement a month, despite taking 4 different laxatives at double the usual doses. We'd pretty much given up, and I was doing an exit interview, you might call it, with her. And one last time asked her about stress in her life. And she kind of misinterpreted my question to mean way earlier in her life and began telling me about the fact that she'd been molested as a girl. I had no idea why she chose to share this with me. I had no training about how to respond. Fortunately, we had a psychiatrist who was in the building, so I got her involved with this woman's care and forgot all about her. I didn't think anything was going to come of it. It was just kind of a last gasp. And about a couple months later, I ran into Harriet, who was the psychiatrist, in an elevator, looking for a way to make a little conversation as we went up, and asked her how this patient was doing. And it turned out the patient was cured, which came as another huge shock to me, that you could cure somebody with a severe, long-lasting physical illness that was completely real just by talking to somebody.
This is Like Mind, Like Body, a podcast about the crazy ways our thoughts and feelings can actually shape our physical health. I'm your host, Laura Sago, and each week I'll sit down with someone who knows way more about science than I do to soak up their knowledge and help you achieve the best physical and mental well-being of your life. This podcast is brought to you by Curable, the online program that uses the power of the mind-body connection to heal chronic pain. You can check out a free trial at curablehealth.com, C-U-R-A-B-L-E health.com. On today's episode, I'm speaking with Dr. David Clarke. You already got a little preview of the crazy stories he has to tell, but trust me, this guy has seen it all. He practiced for 26 years and eventually became the cold case doctor you go to when no one else can figure out what's going on in your body. He literally wrote a book called They Can't Find Anything Wrong. But he's got more than crazy stories to share today. He also gives some great insight on how childhood traumas can show up in our health later in life. Even more importantly, he dives into the topic of parenting and how doing your best with your kids could still lead them to develop chronic pain later in life. But no reason to freak out. He also gives some pretty clear advice on how to stop that from happening. You do not want to miss it. So without further ado, let's get to the interview. Oh my gosh, great. We finally did it. Eric, can you hear too?
Yeah.
Okay, cool.
Thank you, Eric.
Thanks, Eric. Eric's always rescuing me from technical crises.
I usually don't need rescuing, but definitely with this one I did.
I'm really nervous. This is my first time
That's
interviewing
okay.
for a podcast.
I've done
too.
this, 150, 200 times. So
Okay. Maybe you can
you're gonna
ease
do
my
great.
nerves. Thank you. Well, thanks so much for joining us on the show today, Dr. Clarke. Before we get started, I'll give our listeners a little bit of context on what you do. So the bulk of your career has been focused on something you call stress illness, which, as I understand, is a term used to describe a pretty wide range of physical symptoms, everything from IBS to chronic back pain, fibromyalgia, migraines. And the idea behind kind of this stress illness diagnosis is that sometimes these physical symptoms are not a result of a hopeless, incurable disease, but are actually a pretty natural reaction from the body to stressful events in our lives or strong repressed emotions, maybe even emotions that we might not be aware of. So my first question for you, how did you think of this approach in a way that led you to call it stress illness? Because I know most illnesses have some component of stress involved in them. What makes this kind of diagnosis different?
Well, What makes it different is that there is no organ disease or structural abnormality that is present can account for the symptoms. So it's not gallstones doing this. It's not a spinal disc protrusion that's doing this. It is a stress-related, probably a change in the circuits in the brain that are responsible for this. We're still working out scientifically exactly the physiologic process that lies behind this, but there's already evidence from functional magnetic resonance imaging studies that people with these conditions have a different pain processing circuitry in their brains than people that don't have these conditions. So that's a rather complicated concept to get across to people. So I was looking for a simpler concept that people could relate to. So in my book, I called it stress illness. It is entirely possible to be coping with a heck of a lot more stress than you're aware of. And by systematically looking into people's lives to find out where the stresses are and how big they are, we can make a huge difference to their physical symptoms.
Right. And I know you have a lot of great examples of that actually playing out in your practice over the last several decades. But from what I understand, you didn't actually get into the field of medicine with any intention of focusing on this concept of stress and physical symptoms. So what happened there? How did that journey unfold for you?
You're absolutely right. I was a very traditionally trained physician. I was supposed to become a full-time specialist in gastroenterology, and that's how I expected to spend my career. But after 7.5 years of my 9 years of medical training, I encountered a patient that none of that training was useful for. She had been severely ill with gastrointestinal problems for 2 years. She was in her mid-30s. She lived in San Diego. They had done a thorough evaluation at the university there. I was at UCLA, and my training at that time, they sent her to us for some very specialized evaluation of the muscle contractions of her bowels, and that turned out to be normal as well. We'd pretty much given up, and I was doing an exit interview, you might call it, with her, and one last time asked her about stress in her life, and she really didn't have any. She was happily married. She worked part-time as a bank teller, and everything was good there. She had 2 kids that she enjoyed. And so then I asked her, well, what about, earlier, did you have any stress then? Thinking that, maybe some terrible thing happened to her 2 years ago, right when her symptoms began. And she kind of misinterpreted my question to mean way earlier in her life and began telling me about the fact that she'd been molested as a girl. And it turned out that she'd been molested by her father an average of once a week for 8 years, from age 4 to age 12. And that came as a complete shock to me. Not only had I never heard such a thing from a patient before, I had no idea why she chose to share this with me. I had no training about how to respond to such a history from someone. But I kind of fell back on some things I had learned very early on in medical school, which was when you encounter a story from somebody, try to get the details, try to work out exactly what happened chronologically and numerically. And so I just sort of, as a reflex, fell back on that and asked her question after question about what happened. She was perfectly willing to share these extremely personal and painful details with me, but I had no idea what to do with it. Fortunately, we had a psychiatrist who was in the building. I didn't really know her that well, but I knew she was interested in mind and body disorders. She was not only certified as a psychiatrist, but also as an internal medicine doctor, which was quite unusual. So I got her involved with this woman's care and forgot all about her. I didn't think anything was going to come of it. It was just kind of a last gasp, and never really thought there would be any benefits from it. About a couple months later, I ran into Harriet, who was the psychiatrist, in an elevator, looking for a way to make a little conversation as we went up. And asked her how this patient was doing, and it turned out the patient was cured, which came as another huge shock to me, that you could cure somebody with a severe, long-lasting physical illness that was completely real just by talking to somebody, a 1 hour weekly counseling session for 2 or 3 months. And all these medicines that she'd been taking, she no longer needed. That just blew me away. I didn't have any idea that you could do something like that. So I kind of began getting myself more involved with Harriet, trying to understand how she did this, how she thought about these things. I thought, I'm going to be a stomach specialist. I need to be able to manage whatever's coming through the door, however peculiar and bizarre. Even if it's only a couple cases a year, I should know how to do this. Well, my second shock was when I got into private practice and found out it was not 5 or 6 cases a year, it was 5 or 6 a week.
Wow, that sounds like an insanely transformative kind of experience. What was it like going from this one patient and feeling that spark inside of you saying, I have to figure out how to do this, to realizing that it wasn't 5 or 6 a year, it was 5 or 6 a week? How did you even figure out that this is what was actually wrong with people?
Well, it just came by trial and error, by asking people questions. I had some ideas from Harriet about what to ask about. I certainly learned from that first patient that you want to ask people about experiences they had as children. One particularly useful question was to ask people how they would feel if one of their own children was growing up exactly the way they did. And it was that began to connect people consciously with some of their emotions from the past. And then they were able to put that into words for me, which turned out to be a crucial step in their getting better. But it was also a crucial step in my education, because they were giving me pieces of the puzzle, one by one. And over a period of 3 or 4 years early in my career, just this sort of fog of confusion that I had about what was really causing the illness in these patients finally began to clear. And what was a real turning point for me was a patient I saw in the mid to late 1980s who had baffled physicians at a major university hospital on the West Coast for 15 years, to the point where when I went in to see her, she came into my hospital, she had another one of her attacks, and she said, doctor, don't waste your time with me. I've had all the tests. Nobody can find anything. You'd be better off seeing your other patients. Well, by then I knew what to look for. And it was less than an hour when we made the connection that her attacks of illness were all connected to her abusive mother, who was still mistreating her when the patient was 50 years old. And once the patient saw that, once she had conscious awareness of just how much emotional tension there was in that relationship, it was like the light bulb went on. I can still see her face looking up at the ceiling at that moment and saying, "Oh my God, I can't believe it." And in her case, what was really dramatic was that was the end of her illness. I mean, she called me a year later. She hadn't had a single one of her attacks. She was able to deal with her mother successfully. The emotional tension kind of drained away, and she was able to have conscious awareness of all the things she'd been struggling with for years. That was a huge case for me. That was when I finally recognized that I was onto something that could be enormously useful for people.
So is that how this normally goes? People just, all of a sudden, the connection is made clear to them and they say, "Oh, wow, I'm better. That's all I needed."
I wish it was, Laura. I really do. It's really only, to be honest, 10 or 15% of people that have those sudden revelations and very rapid responses physically in their symptoms being relieved. Many other people at the other extreme of that, they're going to need years of psychotherapy to achieve the same kind of outcome. But even those patients, they can at last recognize what is responsible for their symptoms, which is huge for them. Living your life, being ill and not knowing why, is a burden in and of itself. So being on a pathway that they can see is eventually going to lead to physical improvement makes all the difference in the world.
So I know you mentioned a couple of cases, both of which had to do with this childhood stress that people normally wouldn't associate with illness 20, 30, 40 years down the road. So how much of this stress illness do you think is actually caused by these traumatic childhood events? And how does that work biologically, that there's this lag time of decades before it really shows up in people?
Well, that is a long process. Relatively briefly, the process begins with treatment of the child that makes them feel like a second-rate human being, that impacts their self-esteem in a negative way, and typically also creates emotions, anger, fear, shame, grief, guilt, that typically get repressed and remain repressed for many years. Other outcomes from the childhood adversity are more positive. People become very detail-oriented, compassionate, sometimes perfectionist, very, very helpful toward other people, sometimes, overly helpful. But all of those positive qualities, I mean, the world loves people with those qualities. They're exactly the kinds of people you want to be your friend, your coworker, your supervisor, your employee, your neighbor, your spouse. And so people get a lot of positive feedback from the world in general. And gradually that support improves their self-esteem. They begin to feel like they're much better people than they did when they were children. And eventually they can reach a point where they feel like, you know what, I'm actually a pretty decent human being. And these terrible experiences that I went through as a kid were really not my fault and not something that I deserved. And often at that point is when they first form a relationship with a mutually supportive partner, not always, but not infrequently. But it also starts to stir up some of those repressed emotions, because the more positively you think about yourself, inevitably, the more you recognize how badly mistreated you were as a kid. And those negative emotions start knocking on the door. But you've got years and years of skills at repressing them. So if those emotions have no way to reach your conscious awareness because of that repression, if they have no way to be put into words because of that repression, they end up getting expressed via your body. And they can go almost anywhere in your body. They can go multiple locations in your body at the same time. So it's possible to have, for example, migraines and back pain at the same time, or pelvic pain and diarrhea at the same time, or difficulty swallowing, or numbness and tingling in your extremities, or chest pain, or joint pain. I mean, the list of symptoms that can result from this is virtually endless. And it's all from these emotions looking for a way to express themselves. The more you put them into words, the less they need to go into your body. And that's what results in the relief of symptoms.
I mean, everything you're saying just, it really resonates with me. I would consider myself someone who grew up in a really loving household with parents who, did their best. And I still, had adverse experiences and turned out to be one of these people who you're talking about, who had pain as a result of this. How does someone do their best as a parent and try to protect their child from something like this? Is there anything you can do?
Yes. It was an interesting experience for me to learn from my patients about this wide range of different sorts of adversity that they had experienced, and to recognize that there were lessons in that for my own parenting. I have two boys. They're now in their 30s, but when I was first doing this work, I learned a lot about parenting from listening to my patients talk about ways that their own parenting had injured them, and it helped me to think differently about how I was raising children. For me, my work as a physician is very detail-oriented, trying to be as skilled as possible, making sure everything goes well, finding any little areas of my practice that I could improve. And when you do that same thing, which has been so successful professionally, if you apply that to your kids, you can always find, no matter how good your kids are, you can always find ways that your kids can improve, probably on a daily basis. And it can feel very constructive as a parent to point this out to them. Hey, you could have done this better, you could have done that better. But the message you're sending them is that no matter how hard they try, they're never going to be good enough. They're never going to accomplish something that you can praise them for, make them feel good about. They're never going to feel successful. It's going to impact their self-esteem if you're doing this all day long to them. And you may be feeling like you're doing exactly what you should be as a parent, but you're sending them the wrong message. So I learned from that, and I tried to ignore a lot of little things that I could have pointed out, and just bite my tongue and be quiet. And if I caught them doing something well, I would immediately try to point out, you don't want to praise people for no reason. There has to be reality behind it. But if you can catch your kids doing something well and point out that you're pleased with that, you're proud of them for that, that gives them a home in which there is always going to be a solid base of support. And that made a huge difference to my kids. And I was very grateful to my patients for helping me learn that.
Mm-hmm. So what do you think, do you feel like that's the advice you would give to your own sons about parenting at this point, or is there anything else that you would add?
It is, and in fact, I've shared this with them. This same story that I was sharing with you about my transformation as a parent, because kids are, when they're outside of the home with their teachers, with their peers, there's always going to be people pointing out to them, what they're doing wrong, criticizing them, sometimes bullying them. That's always going to go on. But if the kids are coming from a place, namely their home, where they know they've got a solid basis of support, where they are made to feel like they are good people who have the affection and love and support of their family, then they're going to be able to go out into the world and brush off any of the adversity they run into out there. And I think, that makes a huge difference, especially, I'm not saying, you don't point out things that they could do better. That's always going to be part of parenting. But especially when kids get to be teenagers, they're going to have countless opportunities for making bad choices. And they're going to be beyond the range of direct parental supervision. So what's going to make them choose wisely in those situations and minimize the harm they might be at risk for? And I think a lot of that is going to come around to how much they want to avoid disappointing their parents. And that's going to come around to how much love and support they get. What is the ratio of praise to support in that, praise to advice and criticism in that household? And there's a athletic organization for youth in California that I happened to read about a few years ago, and they recommend a 5-to-1 ratio as sports coaches, a 5-to-1 ratio of praise to advice. And I think that same ratio works really well for parenting.
That's really interesting. Do you feel like once you learned all of this, it put anything into perspective for you about your relationship with your own parents?
Well, I think in reflecting on that, I found that most parents do the best they can. If you in some of my work, particularly with adolescents, I was able to interview the parents as well and talk to them about their own parents. And it's very clear that many of these issues ripple down through the generations. And if a parent has some flaws, you can usually find the source of those flaws in that parent's own childhood experience. So this kind of led to my definition of a good parent, which is someone who has created a better environment for their kids than was created for them. Nobody's going to be a perfect parent. I certainly wasn't. Nobody is. It's just too darn difficult a job. And people look at me when I say that, and they're going, Dr. Clarke, that's a pretty low bar you're setting for me. And my point is exactly that it is, not an accomplishment that's out of reach for you. If you want to be a parent, you don't have to be afraid you're going to be like your own parents were. You can learn from that experience, and you can be better for your own kids than they were for you.
Mm-hmm. So for someone who's in the position of having these former bad parental relationships, is it necessary to go back and try to repair those relationships to get rid of the pain at all? Or is that something you don't really have to do?
I haven't seen that be necessary, or I'm really not even aware of it happening very often. Many of my patients, they did want to achieve some kind of reconciliation. They did want to get their parents to recognize the magnitude of the transgressions they committed. And that usually doesn't work out. Certainly you can, once you've got a full accounting of all the transgressions they committed, you can give some consideration to forgiving them, to trying to understand perhaps what it was in their own childhood upbringing that led them to be to do such a poor job as parents. But I think the most important thing is not going to be reconciliation or even forgiveness. It's going to be simply recognizing the full magnitude of the transgressions, the impact on your self-esteem, the negative emotions that may still be buried in there around that experience. And finally, and I should have mentioned this earlier, recognizing what it takes to overcome something like that. I emphasize to my patients that the definition of a hero in our society is somebody who's overcome a difficult physical or emotional challenge for a good cause. And my childhood stress survivors have done exactly that. They, if you imagine your own kid trying to survive experiences that you did, I think you recognize just, how much it takes to endure that. Even endure that for a week would be tough. And most of my patients went through this adversity for close to 1,000 weeks.
Mm. So, all of these are pretty extreme and incredible examples of what physical and emotional connections look like, the way in which really deep or even repressed or unconscious emotions can have this insane physical toll on the body. What would you say is the most extreme or incredible example you've seen in your career of thoughts and feelings affecting the physical body?
Well, there have been a number. That very first patient who was molested by her dad, she was having one bowel movement a month, despite taking, on the average, despite taking 4 different laxatives at double the usual doses. I've had 2 patients who were each in the hospital for 77 straight days with stress-related physical symptoms. One of them with nausea and vomiting, and the other with abdominal pain. And they asked me, the one with the abdominal pain was a 17-year-old girl, and they asked me to see her after she'd already been in the hospital for 10 weeks and she was getting 250 milligrams of morphine a day, which is a dose that you would normally give to somebody with widespread cancer. And yet we were able to get her out of the hospital in a week and off of all narcotics in a month, just by uncovering the stress that she was coping with. Another example was a patient who had stress-related symptoms for 79 years. She experienced an extreme stress in her life when she was 8 years old and was still suffering the symptoms from it at age 87 when I saw her for the first time. So this is capable of causing the full range of physical symptoms, really no different in duration and severity than any other form of illness that I worked with.
Oh my gosh, those sound insanely difficult to cope with, and I can't even imagine what these people went through.
But the good news is all four of them got better.
That's great.
Even the most extreme levels, once you uncover what's going on, people make good progress.
And it's interesting that they just don't know what's going on with them, and so they have really no choice for a number of years before they run into a treatment approach like this, but to go on narcotics and opioids and all kind of things that aren't actually that helpful for them. What percentage of people, if you had to make an estimate, who are on really serious drugs and undergoing serious hospitalizations and things, what percentage of them do you think could actually be helped by this more effectively?
Oh, it's got to be 99%. It's very high because
That's high.
I mean, it's shocking. This was another one of the revelations in my practice, was just how much stress people can be struggling with and yet not be consciously aware of it. These are people that if you met them casually, you would never guess what they were struggling with. These are not people that come into my office banging their heads against the wall or shaking their hands in frustration. They appear to be just, like anybody else in the world. And the fact that they're carrying, 800 pounds of stress on their shoulders, you would never guess. But once you start asking the right questions, if you know what to look for, then you can uncover what's going on, and it always makes a difference. Some people, especially people that are, heavily into narcotics for their symptoms on a long-term basis, my experience has been that their progress is very slow. I mean, it's a matter of years and years before they're going to have a major change in their level of symptoms. But as I say, even those people, they finally are able to recognize that they are on a pathway toward improvement for the first time.
Okay, so Jared Kushner, responsible for, among many other things, solving the opioid crisis in America today. If he is in front of you right now and saying, "What do I do, man?" how do you respond to him?
Well, we need to train our behavioral health clinicians and our mental health professionals that the techniques that they already have been trained in and have experience in can be applied with, a little bit of a twist on it, a little bit of extra knowledge. Those techniques can be applied to people who are physically ill. Our mental health community already knows how to deal with this. All they really need is to recognize that, sometimes it's responsible for physical symptoms. So it wouldn't take much to bring the mental health practitioners in the United States up to speed and help them use those skills to begin to dial down the opioid prescriptions.
Mm-hmm. That's awesome. And if you relate to anything that you've heard Dr. Clarke say today, be sure to go pick up a copy of his book, They Can't Find Anything Wrong, or visit his website at stressillness.com. Thank you so much for joining us for our very first episode. This was so insightful and great.
Thank you, Laura. I appreciate being the very first episode, and I'm so delighted with the Curable app and everything that it does for patients. It's been a great addition to the field.
Thank you so much for joining us on our very first episode of Like Mind, Like Body. Don't forget to tell your friends and subscribe. Maybe leave a review if you're in a nice mood. If you're wondering what Dr. Clarke was just talking about, it's Curable, the online program that brought you this podcast. It's designed to help people address the emotional factors of chronic pain through the same methods that people like Dr. Clarke use. So if anything he said today really resonated with you, you think this might actually apply to you, you can check out a free trial at curablehealth.com. That's CURABLE health.com. All right. Thanks. That's all. Bye.
That was a good job, everyone.
Well done. Good job.
All right. So
Thanks so
we
much.
remembered to push the record button.
Yes,
Yeah,
we
we got
remembered to
that.
push the record. We've got it all down. That was